Thank you so much, Raquel, for sharing your story.
It's so great that you're talking about this because you made a decision when you were significantly younger. You thought of things differently than you do now. So maybe to help the other people out there before they make this decision, what little things can you do, you know, before you even go see the doctor? And the doctor is going to show you the choices of implants available. But to help women out there, there's something they can do at home themselves with a little bit of rice and some knee-high stockings. It's just stuff.
Figure out what size.
Exactly. And rule of thumb, an ounce of rice is going to equal 30 cc's of volume in a breast. So you can create your own little at-home breast implants, put on a bra, and I guess I'm going to have to put this on, huh? So put your bra on and, you know, get your little bags of rice and size them out and give you an idea even before you go in to see the plastic surgeon about the size. But, you know, in your case, you went so big that I think you're suffering from the weight. And, you know, if you can imagine, this would represent the weight that's being pulled on your body. I can see how that would hurt your back, your neck, your posture.
It's a lot of weight.
The strap marks from your bra. So that being said, you need to very carefully look at your options. So now at this point, you want to be a little bit smaller, right?
Correct.
Well, what we need to do at this point is the operation you could have done from the beginning. Is a smaller implant with a lift. I'm not going to say that you did the wrong thing because it was many, many years ago and maybe that's what you wanted, but now the only way to correct it is to remove the existing implants, smaller implant if you want that, and for sure do a formal lift. And that's a little bit of a bigger procedure. The first thing that we would want to do is make an incision in the bottom of the breast, right? Remove through that crease incision, boom, that implant would come out, pop out like that, and we would replace that. You would go with a smaller implant, and at the same time, we do have to make those additional incisions to do a formal lift for you. So it would be that anchor incision where we make an incision straight down like so, and in the crease to get rid of that excess skin, to lift your nipple areola, to reduce the size of your areola if necessary. The trade-off is the additional scars, bigger surgery, but that's the right operation for you and would leave you with breasts that fit the rest of your figure
And
better.
to validate you, you know, women in my practice struggle with this all the time to get their bodies back to normal. It really boosts their self-confidence. And even with, I have so many women who struggle with the idea of the lift because of the scars. Even with the scars, they are so happy. I cannot tell you how many women will come in and just, you know, show me and my office staff to just come in and go, look at my breasts.
You can imagine what my office is like.
And they feel so good. So just know that you were going to have surgery. Now you're just monitored because you know, either fixing it for you, and you're just going to feel so much better. And for the mommies out there who, you know, whose bodies have changed and they don't feel good about their bodies after their babies, they feel great about their babies. It's restoring to normal, so you don't have to feel guilty about the surgery. It's really important to restore your confidence.
And do your homework ahead of time. Don't be afraid to ask questions. Ask to see pictures.
Absolutely.
Your doctor would expect you to do that.
Yeah, thank you. I appreciate that. Thank you.
Yes.
Thank you, Raquel and Daniel, for coming on the show.